Hi, I'm Dawson Huss with the Diversity Consortium. I recently sat down with Randall Dobbins and Roger Peterson to ask them about the challenges facing small businesses who are trying to provide meaningful and cost-effective healthcare benefits for their employees.
My name is Randall Dobbins. My company is Diversity Works. We've been around since about 2004. The healthcare thing is a big question mark for a lot of people. On the one hand, you want to just simplify it. It is how much is it going to cost for me to offer a plan, and can I afford it? So as an owner of the business, I need to figure out, how do I do this? How do I attract good people? How do I put a competitive compensation or healthcare program benefits package together? And how do I do that in a way that attracts good people and allows me to still make money?
Well, my name is Roger Peterson. I've been involved really in the healthcare industry since 2016, both as a service provider and a consultant. For employers who cannot afford to provide, I would call it classic healthcare insurance offering as a benefit to their employees, and a lot of these are going to be your small businesses, new businesses. They just can't afford to provide healthcare insurance in the same way that large multi-billion-dollar companies can.
And then I still have to continually look on a regular basis as to what my options are. Every year, do I need to go through and, tell my employees, hey, we got an update to the benefits package. Here's the list of folks we're going to go through on a regular basis. And then you throw in the consolidation in the healthcare industry. And it's like, trying to manage all of that and the business just becomes a nightmare.
So, looking forward, do you see these healthcare challenges facing small businesses getting better or getting worse?
It's only going to get worse. Um, as we see more and more employer mandates come down, more and more regulations and whatnot, I'm sure there'll be things in place to address it. But the issue becomes, is it economical? There's only so much you can throw into the cost of doing business before somebody comes up with a better mousetrap. The good news is we have a competitive environment. So to the extent that there are options available to small business owners to stay informed, then there are some things that we can do. But if it's one of those areas that we don't stay on top of, we're unaware, if we're definitionally, ignorant of different options out there, then I think we're going to price ourselves out of the out of business.
It's a very legitimate challenge, and for somebody that's not experienced in what's out there, they can go sideways quickly. Yeah, I mean there are some new solutions that can be very helpful, and what that means is it's even more complicated, I think, for people to figure out what to do in these different scenarios.
So, is there a cost-effective solution for small businesses to provide healthcare benefits for their employees?
So direct primary care is a fantastic alternative. It enables you as the employer to provide some primary care, some healthcare solution to your employees at a dramatically reduced cost, and therefore it helps you in your war for talent.
I think the best thing that we can do is a good menu of choices, good menu of options that actually does address the core issue of providing access to care at an affordable cost to make sure that we have viable, thriving businesses. And what I'm encouraged by with what I'm seeing through the consortium is just exactly that. Something that is so attractive and solves so many problems that the consortium is once again being a key ally to making sure that XBEs can indeed thrive and succeed.